Dr. Fauci or Dr. Birx. Can you talk about your concerns about deaths being misreported by coronavirus because of either lack of testing or standards for how they're characterized?
So I think in this country, we've taken a very liberal approach to mortality. And I think the reporting here has been pretty straightforward over the last 5 to 6 weeks. Prior to that, when there wasn't testing in January and February, that's a very different situation and unknown. There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Or are you sure? How can you be confident about that? And is there any concern that it skews the data that you're trying to collect in terms of projections and things like that?
Well, I think that would apply more to rural areas that may not have the same level of testing, but I am pretty confident in New York City and New Jersey and places that have these large outbreaks and COVID-only hospitals. I can tell you they are testing. New York and New Jersey together have, by proportion, are testing extraordinarily well as Washington State and Louisiana. So I don't see that there's been a barrier in testing to diagnosis.
No, I think there's so much focus now on coronavirus that, particularly if you take New York, which we all know is having a disproportionately higher proportion of the burden of the entire country is right now in New York. I can't imagine if someone comes in with coronavirus, goes to an ICU, and they have an underlying heart condition and they die, they're going to say cause of death, heart attack. I cannot see that happening, so I don't think it's going to be a problem.